Okay, let's get started. So, good morning, everyone, and a really big welcome to this Health Foundation webinar with Frameworks UK, looking at how we can tell a more powerful story about health and health inequalities. So we've got some fantastic speakers today, including from two councils who have been working with Frameworks to communicate differently about health. So we're hoping that today should be really practical and give you some ideas and inspiration to try things in your own settings and find out a bit more about the work that Frameworks have been doing. So just as a bit of background, we've been working with Frameworks since 2017. We started working with them as we wanted to find a more compelling way to talk about the role of the wider determinants of health in a way that avoided the conversation defaulting back to the NHS. And this is really core to the work that we do at the Health Foundation. I should say that I'm Catherine Merrifield and I'm an assistant director in the Healthy Lives team, leading our work around supporting councils and other place-based organisations to take action on the wider determinants of health. And this focus on communicating the importance of the wider determinants of health is really core to our work. So we really wanted to be able to frame our communications differently to build that wider conversation and to support the policies and actions that are needed to make change happen. So we've been working with Frameworks for some time, and in 2022 we published our toolkit, How to Talk About the Building Blocks of Health, which hopefully some of you have seen and we'll put in the chat now. And there was lots of interest in this. So we commissioned Frameworks to work with public health organisations to learn more about how to embed the different approach to communicating. So today we're going to be hearing from Maria Castellina from Frameworks about the toolkit and what they've learned about how to embed that approach. We're then going to hear from Chimeme Egbutah from Luton Borough Council and Dawn Jenkins from Nottinghamshire County Council about their experiences in having a different conversation about health. And there will be time for questions at the end. So before I ask Maria to give her presentation, just a few bits of housekeeping. So the event today is being recorded and the recording will be available on the website within 24 hours and a subtitle version will follow as well. As I said, there will be a chance for questions, so please do start thinking about things that you want to find out more about as you listen to the speakers and use the Q&A function within Zoom. Do also upvote questions that you're particularly interested in. Also on questions, Kate Stanley, Director of Frameworks UK, is with us today. We're really grateful that she's been able to spend the time, so thank you, Kate. She's going to be looking at the Q&A and answering some of the questions as we go. So yeah, look out for that as well. Finally, for anyone wishing to post about this event on social media, today's hashtag is Building Blocks of Health, all one word. So do that, promote to your networks. So I think that's about it. Thank you again for your time today. We're really looking forward to digging into this really interesting issue a bit more. So to start with, I'm going to introduce Maria. She's Director of Impact at Frameworks UK, and she's been working with us on this project for some time, a real expert on the area. So she's going to talk to us about what Frameworks have learned about how to tell a more powerful story about health and health inequalities. So Maria, over to you.
Thank you for that introduction, Catherine, and hello to everyone on the call today. It's wonderful to have so many of you joining us. I am just going to do the usual, share some slides. And hopefully that is working for you. Now, this morning I'm going to talk to you about what it takes to really put this new story into practice. But first I want to recap on what this story really is and what it can help us to do, just to make sure that we are all on the same page. Now, as Catherine mentioned, the Health Foundation brought Frameworks in a number of years ago because they recognised that despite all the overwhelming evidence that to improve health in the UK, we need to address those fundamental building blocks of health, things like homes, jobs, education and transport. And despite all the evidence that showed to improve health, we need to address those wider determinants. We just weren't seeing the political, the policy, and the practical action that is really needed to improve health, reduce health inequalities, and save lives. And what our research found was that how people think about health is a large part of the reason why we weren't getting the cut through we needed. And there are three really dominant mindsets in the way people think about health that I just want to recap with you that are a challenge for those of us working to try and improve health in the UK. Now, the first of these is kind of individualism, and this is the sense that we are healthy or not because of how we take care of ourselves. It's the food we eat, whether we exercise, whether we drink or smoke, just down to our own actions. The second very dominant way people think about health is simply that health is medical. It's doctors, nurses, and the NHS. And thirdly, that health is just the absence of ill health. So if you're not sick right now, you must be healthy. And what's missing from each of these dominant ways that people think about health across the UK is the wider context that actually shapes our health. It's not top of mind. It's not where most people go to when they think about health. All of those wider factors, our homes, our jobs, our local neighbourhood, they're just missing from view. And so we need a story that brings those factors to the foreground and helps people see the powerful role they play in shaping all of our health. And so what our research showed was that we can talk about health in ways that really secure buy-in and drive change on the wider determinants of health, but we need to do three things. First, we need to raise the stakes and really highlight why this issue matters. And action on the wider drivers of health matters because right now, some people are dying more than a decade earlier than they should, more than a decade earlier than their peers. And that's because they don't have access to the things they need to be healthy. And we really need to highlight that injustice and talk about it. Highlight that that is something we should all be concerned about and need to address. Second, we really need to show how our surroundings shape our health. And we can use this really powerful metaphor, the building blocks of health, to help people see that we need each of these different blocks in place. Our homes, good jobs, enough money to pay the bills in order to build a healthy, thriving UK. And finally, we need to show that actually there are specific things that we can do that can make it better, that can improve health across the UK. And we need to talk about those as often and more than we talk about the problems. Now, on the next slide, I want to show you a short animation produced by our friends at Health Equals. Now, Health Equals are an umbrella campaigning group funded by the Health Foundation, really campaigning to drive forward action to improve health across the UK. And I want to show you this short animation that they've put together because I think it really brings this story to life.
Being healthy, it takes more than you'd think. That's because our health is shaped by the world around us. It's the air we breathe, the homes we live in, the work we do. These are the building blocks of our health and well-being. We all want to make the right decisions when it comes to our health. Eat well, get out more, stay active. But life's pressures mean we often make these decisions based on time, money, and the options we have in front of us. When we're strapped for cash, can't reach a nearby park, or don't have local shops to buy affordable healthy food, making healthy choices can be hard. Too many of us in the UK are being held back from good health. Take work. If we're working long hours, juggling multiple jobs, we don't know where our next paycheck is coming from. It can take a toll on our mind and body, and keeping food on the table, heating our homes, or even just getting by after the bills are paid, all add to the stress and worry. And what about where we live? We should all have a safe, warm, and affordable place to call home. But living in cold, damp, moldy places can make us sick. And for some of us, we don't know where we'll be living from one week to the next. When one building block is missing, our health suffers. And when more than one is out of place, it can lead to stress, illness, and even cut our lives short. But it doesn't have to be like this. Together, we can make sure the building blocks of health are in place for everyone and create a future where we all have the opportunity to live healthy lives. Find out more at healthequals.org.uk. Being healthy.
And I just wanted to show you that because I think it's a fantastic example of this story in practice and how it's being used to really shift the conversation. So that's just a quick recap on what the story was, but what is the impact of this so far? Now, what's been brilliant to see is that this story is being really taken up by public health teams across the country. And we've seen people really re-energized. Suddenly, they have a way to talk about the vital work that they all do in a way that people actually hear and take on board. When I've talked to public health colleagues, they've talked about how this has enabled them to have a shared language, which they can use to talk to the NHS, to talk to local residents, and to talk to elected members. And suddenly having that shared language means that people are on the same page and we're able to cut through. We're already seeing this story repeated, taken up by the media, by local authority communications, and by politicians themselves, showing that it's resonating, that it's cutting through. And vitally, we're already seeing the story help to influence and shape policy and practice. We've seen it be used to shape the way that councils engage with and talk to local people, enabling them to better understand and deliver services which will improve health locally. We've seen it being used to get elected members to recognise the importance of the building blocks of health and prioritise council resources on addressing them. And we've seen it be used to really shape policy. For example, this way of communicating, this story, has been used to influence the Scottish Government on its new population health framework. So this story is starting to do what we need it to really drive forward change. But what I'm sure lots of you on the call want to know about is, how do we do this? If we know it's working, if we know it's powerful, how can we put this story into practice in different places up and down the country? Well, from the work that we've done so far, there are 4 lessons that seem to be vital for embedding this story successfully. So the first is about collaboration. The second is about the importance of dedicating time and resource to this. The third is to recognise that this is a communications approach. And the fourth is about planning for the long term and the sustainability of the work. I'm just going to talk you through each of those briefly. Now, for this approach to succeed, it can't be undertaken by just one team or one part of an organisation. It really does take collaboration. And it's important to recognise that kind of relationship building takes time. So where we've seen the approach be successful, people have put in place a plan for how and when they're going to engage with all of the different key stakeholders, whether that's senior leadership teams, your communications teams, and wider partners like NHS colleagues and voluntary sector partners. And we found that buy-in from senior staff early was particularly helpful for project success, as they could champion the work across the organisation and ensure that it was appropriately resourced. And actually, we found that face-to-face time with key people, key partners, was particularly important for kind of inspiring and exciting people about the approach. The second thing, which may sound obvious, but was really important to success, was ensuring that the project has dedicated time and resource. Communicating in a new way can take time and practice, and often people are having to unlearn what they previously thought of as good practice. So, for example, when it comes to the way that we communicate about data. So people need time to practice this new way of communicating. And we found that for this to be successful, we really need to have people leading and championing this rollout, as well as people who are responsible for building kind of relationships with other teams and partners. So that time and resource was important for success. Thirdly, what we found is that public health teams across the country are stressed. They're having to do a lot of work with often not a lot of resource. And sometimes early on, people were confusing this approach as almost in competition with the other work they were doing. You know, we know that there are other approaches to kind of the policy of the wider determinants of health, whether that's kind of taking a marmot approach or a place-based approach. But this doesn't replace your policy approach. It's simply how you communicate about it. And that distinction can be quite important to make sure we get people on board with why this matters and how it works in conjunction with the other things that you're doing. And finally, what was really important was for the success of these projects, for people to have a plan for how it could be sustained in the long term. So for it to really drive forward change, it's something that we need to be repeating again and again across our work. And so where we can, we need to think about how it can be mainstreamed into kind of public health teams' business as usual. How can we use this story across all of our work? I know some partners have found that they use this story now as the default way to kind of introduce any new piece of work, any new report, any new policy papers, to make sure that this is embedded across the communications. And one of the things that people have found useful, particularly in the medium term, is to almost develop a community of practice. So people who have been upskilled on the approach, who are interested in using it, who can champion it across the organisation and support colleagues to use it too. So those are just some of the ways that we found have been really powerful for practically putting this story into place. But I know that it's going to be really useful to hear from Chimeme and Dawn shortly to bring that to life for you and show how that's been used. So I'm just going to hand back to Catherine now before we hear their stories.
Thank you so much, Maria. That was a really clear laying out of a tremendous amount of work that I know has been going on over many years, and some really practical tips as well for doing things differently. So thank you. Yes, as Maria says, to bring this further to life, we're now going to hear from Chimeme Egbutah. Chimeme is a public service manager in Luton's Public Health Department, and she's going to tell us a bit more about the experience in Luton Borough Council of using the building blocks approach. So Chimeme, over to you. Thank you.
Thank you. Okay. I can't see you all, but I'm hoping that you can see my slide.
We can, Chimeme,
Okay.
although they're not in slideshow format at the moment, but don't worry too much. That's it, perfect.
Fantastic, great. So thank you, Catherine. My name is Chimeme Egbutah. I'm actually a public health service manager in Luton Public Health team, and I hold the portfolio around, not solely, of course, but lead on health inequalities and communities, or health equity in communities. And my work is essentially around the building blocks of health. And I'll explain a little bit more. And the work that we've done with Maria in terms of trying to start the conversation and the process of embedding this in Luton as a place has been quite transforming. So I'll move on to the next slide. So I'd just like to acknowledge, of course, Maria's on the call, but my colleague who's now left the organisation, Mark van Vastenhoven, he was a colleague in my team who helped roll this out with others. So very, very grateful for both Maria and Mark for working this out, getting the numbers in, getting the people in, although it wasn't very difficult to do that. Okay, so I'm not sure, but hopefully you're aware that Luton is actually a marmot place. We were the first marmot town. I don't know if there are other marmot towns, but there are over 50 marmot places now. And I just wanted to set the context of how this work with Maria's team, Health Foundation, the building blocks of health has come about. So we have a very clear vision in Luton around what we call our Luton 2040 vision, where we want to see everybody living in a healthy, fair and sustainable community and town where nobody lives in poverty. It's very ambitious, and across that we have 5 key priorities. one of them obviously is around improving population well-being, but you can see how those determinants and those cross-cutting themes are also embedded in that vision. So building a more inclusive economy, tackling climate emergency and becoming a net zero, being a child-friendly town, and supporting a strong and empowered community. So as a marketplace, or a health equity town, as we refer to ourselves as, what we've done is try to do the cross-cutting wider determinants, building blocks of health, and seeing how that fits in, and to get that message across, the simple terms and the simple way of explaining it, so people don't automatically default to the NHS and thinking about individual health. You can see that the building blocks is key to that. So in terms of our journey, as I said, the timeline for us is, yes, we came out of the pandemic in 2021, 2020 and 2021, but we really started our journey in earnest in June 2022, where we set up a health equity steering group. The group was at place level with all our partners, and we are fortunate that we have one boundary in terms of lots of VCSC sector. We're very used to working together. You know, we're a very tight-knit borough, and we are within the Bedfordshire and Luton and Milton Keynes ICB. And there's a lot of work around inequalities, equity, social justice that meets our needs in Luton. Come 2 years forward in 2024, we realized that we needed to get that message across better, so that people didn't think that we were talking about the health service. So we're doing a lot of work. The work that we lead in the health equity and communities teams is very much around health and all policies. It's very much thinking about transport. It's thinking about air quality, the regeneration work that we do, comms, inclusive economy, all of that. But to make sure it landed, we knew that we needed a better message in our arsenal, and the building blocks of health was perfect for that. And since then, we've got a microsite, and we have a health equity town prize. So knowing that this was important for us, we decided that we would talk to the health equity system. And what you've got there is a little graphic just demonstrating who those key partners are, following our report that we had with the Institute of Health Equity. It's ourselves as a Luton Council, and we're leading it, but it is actually a system and place-based approach. So we've got our healthcare colleagues, so East London Foundation Trust, we've got the ICS and the ICB and NHS trusts. We've got public services, so for example, our physical activity organisation, Luton, Active Luton. We've got our community, which is key to helping us with this, and our BCSC, FSE sector, so our voluntary and community and faith sector, essentially. And then private sector, key partner for us that we are embedding as we go forward this year, and particularly using, again, the building blocks of health. So we introduced this idea to the system at our first annual conference, where Maria and another colleague did come and speak to it. And it was so powerful, and the energy in the room enabled us to ride off the back of that interest. So immediately after that, we set up another meeting where we handpicked leaders across the system, different organizations, to come along and hear more about the building blocks of health. And at that particular meeting, I think we had about, we had 50 people that showed an expression of interest, and we honed it down to 27 that we wanted. And most of those people were senior officers. We got senior officers within the council to attend, as well as others in different organisations, as I said. We then went on and did another seminar, which was a face-to-face with members and more VCSE sector people. And again, hence you can see why I'm saying a big nod to Maria, because our relationship is that, you know, she spent some time having that face-to-face conversation, and we've sort of front loaded this effort with Maria and colleagues first in order to go on to build and make champions and advocates for this building blocks of health. So in total, in all the training, we've run 3 training sessions, 1 online session, 2 face-to-face session. One of the last sessions we had was a 2-pronged approach. So we had the first session and then we had a second session, giving people an opportunity to start using and thinking about how they use it in their everyday work. Total attendance was 73 people, which for us is really good. And as I said, we've built on the success of the Health Equity Town work and the using that common language of a toolkit and advocates. So if I move on. So this is the feedback that we got. Amazing from the first day that Maria came along to the conference and talked about it, that energy has been maintained. So you can see some of the comments that people have said. We've had good feedback. There was one comment, and it's the bottom one in green, that talks about the fact that it's a challenge, it's a stubborn issue. And what we see the building blocks helping us do is articulate that stubborn issue in a way that's meaningful and understandable. Now, it all sounds great. And as a marketplace, it's easy to kind of talk about, yes, we've done these great things, but there's been challenge. And what you can see with the timeline is that it takes time to build up that momentum and get people on board. So some of the challenges that I wanted to share with you today is that we have had difficulty ensuring that those who want to be training are not already bought into the idea. So we've had some public health people, we've had Health Watch come along. What we need is some of those people who haven't quite grasped the concept of it. So we want to do a bit more around that. And following on from that, we do want to do much more embedding across the system. In particularly, we want to work it with our communities, with our team. I think this is a great opportunity to give some of our diverse communities a language that they already have, but we can help and support them to talk about how their housing affects their health, how in fact that then unable or they struggle because the transport system is not very good in maybe one particular area. So then we also want to maintain that use. So we don't want it to be just a flash in the pan. We want to keep it going and keep that approach. And we've got some plans about how we're going to do that. As I said to you before, this year we are focusing on our private sector colleagues. And in order to do that, we are using the Health Equity Town Prize to help us communicate the building blocks of health, but also getting them to think about their contribution to tackling health inequalities. And of course, we want to monitor the use of that and engage our comms colleagues across different organisations. Oh, I've animated this, so let me just bring them all up. So what's our next steps? Well, what you see here is our Marmot Mountains, which is a term that's been pushed out by East London Foundation Trust, our key partners as a Marmot Trust. And this term that they developed enables us to kind of look at the whole, from the population-based stuff to some of the things that we absolutely are aiming for. And for us, it's Luton 2040 as a town and as a system. Some of the things I would like to draw your attention to is, yes, we want to continue our work and we want to work with our anchor organisation and we want to do cultural confidence and we want to talk to our communities, but we do want to have a way of working. And what we are in the space right now where we've got a draft toolkit that we have developed and are still developing. And one of the key tenets of that toolkit is using the building blocks of health as a common language. Everybody who wants to do Marmot work and think about tackling health inequalities, we want you to have that common language. How are we going to do it? By working with our communities of practice. So the people that have had that 2-day training, we are building their muscle so they can go out and share that, in addition to promoting it and sharing that information with private sector and our communities so that we have a consistent approach across the town. So I'm going to stop here because I'm sure there'll be lots of questions. But for now, that is how we're rolling out the building blocks of health in Luton. Over to you, Catherine.
Thank you so much, Chimeme. That was, yeah, really great and really positive to hear about that work you're doing across the system and involving all of those different partners and stakeholders. And also, I think getting into some of the specific approaches you've been using, like that toolkit on common language, sounds really powerful. So thank you so much for focusing on that how as well as the what. And I think we're going to get a bit more of that from Dawn. So I'd like to introduce Dawn Jenkin. She's a public health consultant at Nottinghamshire City Council. She leads the Healthy Sustainable Places Work programme for the council, and she's going to be talking about the new conversation they've been having in Nottinghamshire with communities and partners. And yeah, can I just remind you, there are some questions going into the chat and Kate's doing a great job of answering those, so thank you so much. But as you listen to Dawn and reflect on what you've heard from Chimeme and Maria, do keep thinking of questions and putting them in the chat, because after Dawn's spoken, we'll have a bit of time to get into that. So thank you, and over to you, Dawn.
Thank you, Catherine. Good morning, everyone. Delighted to be joining you. I'm just going to attempt to share my slides. Now, hopefully you can all see those slides in presentation view at this point.
Yes.
So thank you for the introduction, Catherine. I am consultant in public health in Nottinghamshire County Council. As you've mentioned, I lead on the Healthy Sustainable Places programme, which is a programme we've been running for a good long while, about 10 years. So I'd like to talk to you today about how, having had that long history with that programme, how the building blocks of health approach is really unlocking and helping us to start drive at pace this work in a way that we haven't seen that engagement and that real enthusiasm for this area of work in the past. A little bit of intro on Nottinghamshire itself. We are a large county council, around 900,000 population. We are a two-tier area at the moment, which means that we have a county council as well as district and borough councils. And colleagues will understand that a lot of the levers around the building blocks of health do sit at that district and borough level in terms of housing, planning, etc. at this point in time. And so that introduces interesting dynamics to our work. As I get into this, what I'd like to do is speak a lot about the how, so we can get a lot of the practical insights from what we've been doing since around 2023 on this programme, but also the so what, where we think we're achieving impact and what it means in terms of how we're applying it. As I do that, I want to really mention that this is not my work alone. I'm presenting, but I have a significant cohort of champions in my area, led by Carol Ford, my senior public health manager, who has really been the sort of heart and soul of the Building Blocks programme for us and has had just that vision and that energy to follow it where it goes. And you'll see some interesting contrasts to the approach that Chimeme's used, which I think just goes to show that there are many different ways to approach this and many different ways to communicate a new story. I wanted to start and finish my presentation on the concept of communication today, and just sharing with you, this is a quote that came out in a conversation with our public health leadership team last week that I thought I'd use because it exemplifies how our organisation, the County Council, has really gotten on board with language being so important and communication and telling that story. And this is a corporate director who's talking about how we want to take the new corporate plan for the whole of the county and really embed the building blocks of health into that and make it the driving force for what we do as an organisation. And he talks about we've taken our language and we've put it into the DNA of a large organisation that has the levers to make a real difference for people. So there's that really strong senior buy-in across our organisation from the chief exec throughout. But that wasn't there at the start, and we've built that. So I'll talk to you a little bit about that. Just starting a little bit with my reflections on why I think this works so well as a message and a story. I find that what's unlocking this for us is that we're thinking about health as an asset that we can build on and strengthen. And it's a real message of hope. So health is not static and something that we can't do anything about. It's actually something that we have all the levers and the powers and the building blocks to be able to build and strengthen. I think that message of hope has made a real difference in what can be an overwhelming space when you talk about healthy, sustainable places. But also when we talk about that in contrast, we talk about how too many of our communities are having those building blocks missing and lives being cut short. I think that contrasting message is really important to hit home because it tells us there's a message of hope, but there's a sense of loss when you take a look at this slide, and that we need to do something about that. That's not fair. We need to do something about that. You'll notice I use visuals a lot when I present on this, and I find that's part of our story, part of how we put across the importance of the building blocks. And I think that just that broken down wall just adds for me to that picture and that understanding of how our communities are missing out on having that strong and sturdy building blocks. So where did we start? This is a message of going where the energy is from us in Nottinghamshire. So I had support from the Director of Public Health when I started this program, but it wasn't really sort of wider than that. So I knew that I had the go ahead to take a look at this new idea. But initially, we really thought maybe this is something we'll utilize within public health to try and just think differently about how we talk on this. So we started out really with a very clear bounded plan, which helped us to make this manageable. There's a lot of overwhelm in the system and overstretch. So we were able to get people on board, understanding that this was doable. It wasn't some new, big, huge program of work. And I thought that was really important for us because we started simply and sensibly and thought about how do we explore the use of this message. And then I just went into all sorts of different messages, all sorts of different meetings, talking about the building blocks and using this language a little bit to see what people thought. And whenever I got somebody across our system who was like, oh, that's really interesting, I want to know more. Not necessarily people who knew a lot about it, but people who wanted to know. I invited them into a steering group. So it was a coalition of the willing from the start. We self-selected to explore this new space together, and we got a wide range of colleagues from across sectors to just make a start on this. And from the start, we built evaluation in because we were clear this is something new we're trying. So we need to make sure that we're understanding and learning from it as we go. We then went out to a very wide audience to offer a taster session to see, what sort of bites do we get on this agenda. And from that, people were able to sign up to champion training. And I think we probably had about 24 champions that we started with. So we were selecting in people across the system who had an enthusiasm, who this resonated for, and who were going to be champions to go out there into the system. From there, we built our community of practice, and that's what's maintained the learning and the growth on this. So we built a community of practice which meets regularly. And what we do is we find that although the message of building blocks resonates really strongly and connects and gets a life of its own, what we find is that it's actually quite difficult to change the way we speak and the way we use data. So we use that community of practice for people to come in with live issues of, I'm trying to work with practice nurses. I'm looking at how I speak to the planning team. And we use that to help collaboratively build in that practice around the building blocks of health. And for us, that senior buy-in started to come as the whole system started to rumble with interest. The senior partners and the leadership of the council and other areas started to ask us to come into the room. So actually we got that wider buy-in by almost starting with the roots of the practice with practitioners, and then people started to get interested and we brought it into senior context. We now have the county council absolutely bought in from the chief exec down to this approach, and you'll see in a moment some of the things we're doing practically around that. I wanted to move on to some key learning, just to share what we learned as we went along. One of the key things I think is people think that this is about messaging. It's telling people a story. It's unidirectional, and it might be a comms approach or a media approach. For us, that very much wasn't the case. It's not only that. what we found was that we invited people into a common space to have a conversation, and that's what grew the excitement and the engagement and the action. So aim to create a dialogue when you use the building blocks of health. We found that a lot of the time people didn't agree with us, perhaps didn't agree on the message, didn't agree with how to do something about it, but we were having a conversation. And before that, we couldn't raise the interest and get through the door and get people to talk about this space collectively. So actually, it's no bad thing if somebody's disagreeing with you, but they're having the conversation, they're having the debate, they're investing the time, and we find we move ourselves forward to common action and really getting traction on the building blocks. The second message is something that Chimeme mentioned about involving individuals and community. And this is something that I suppose is a bit unique and perhaps wasn't necessarily where people thought we might start, but actually getting the community to tell their own story about why the building blocks matter to them. And I'll come on to some examples later on. We have found that the most powerful way to communicate the building blocks is for people who are affected by employment, by transport, by the housing, to talk about what it means for them. And this is a really good example from the Director of Public Health Annual Report. I thoroughly recommend you take a look at it. It's all videos based. And that's where you see people recovering from rough sleeping and homelessness, telling their story about how much housing matters to their health and their life. So really allow this metaphor, which really connects, to be a framing to bring community and individuals into the conversation and tell their story. And thirdly, show how you're taking action. So the biggest complaint or opposition we had to the building blocks of health approach at the start was you're just talking. This is just spin. You're telling us messages, but you're not doing anything. And I think that speaks to the really important message that Maria shared with us about always come with a solution and spend more time talking about the solution than anything else. So we found it was really important to take the messages, take the story, and then weave that into showing what we were doing. And I'm going to give you a couple of quick examples that show how we've gotten this woven in at strategic level, at operational level, and at community level. So first of all, talking about this isn't a policy. So building blocks is not a new policy approach or a new way of doing things. It's a communications approach. But what we have done is wrapped that communications approach round our policy and round our program of work. So we did a workshop initially with the Health and Wellbeing Board around the building blocks and got their insights, which helped us to build and learn and change our program. Now, when we go back to the Health and Wellbeing Board on our Healthy Sustainable Places program, we shape it around the building blocks of health. So it gives us a structure, a way of thinking, a way of communicating, sense making, and gives us a coherence to a program that's very large and sometimes quite overwhelming. But when we structure it in this way, we even use the colors of the toolkit and the titles of the toolkit, we bring that coherence and that play through so that people can see that all the things we're doing in this space are about the building blocks of health. So that's at the corporate board level. What about at the communities level? So this has been absolutely heartwarming because our communities and our partners have run with this and made it their own. So this is an example where our local health and wellbeing teams went out into the community and they made their own building blocks. And they used that to have a conversation with one of our communities, which is a more deprived community with a lot of disadvantage. They have a conversation about what are these building blocks and what does this mean for your health? And from there, they framed that communication, they framed the communication around building blocks. They then listened to what they heard back from the community and they framed their offer around that. Then they were able to show impact in terms of the things they did and the way that they supported the community. But they linked that impact back into the building blocks of health. So they could show how the building blocks mattered for the local community, they acted on it, and then they could link it back. And then that creates a coherence and a story that's shared with our board. When we go back to the Health and Wellbeing Board, as we did, and had real impact, sharing these stories of difference for our communities, framing it through the building blocks of health. taking a sort of a strategic and organizational perspective, recently we ran an LG challenge, which is bringing together officers from across the country to compete to solve a really tricky challenge in a council. And the challenge we chose was good employment, but uniquely, for the first time, we framed it as a building block of health. So it was all about how important good employment is for our health, and how health also can drive our employment opportunities. So giving it that framing and bringing together those colleagues to create a system-wide approach to employment meant that when they came back, and this is one of the team's winning proposals for our strategic approach across Nottinghamshire, they had building blocks right at the top of that framing, thinking about what does this mean for health and how is employment a building block of health. And if you look at the bottom left-hand corner, uniquely, instead of talking about economic growth and employment in financial terms, they had now taken on that message, and it was talking about how we are improving physical and mental health and living a full life. So that entirely changed the messaging of our system from incorporating that building blocks language at the start. And a final quick example at operational level. So we've done work on housing, and we've been working for a long while to try and articulate why housing matters to health. And this was a retrofit program where we did some detailed work around the opportunities in terms of saving money for the NHS through doing retrofit work. But we actually, what sold this and what got us going into multiple rooms across our combined authority space was actually joining those dots and doing that explanation that Maria talked about. So explaining why for damp and cold houses have that impact on health, and joining the dots through that explanation approach meant that it connected and resonated in so many more rooms. And we have been able to secure additional funding for retrofit through using this framing in a bid we made for additional funding. And we're able to now target our retrofit because we've made that case about health inequalities as a driver for where we should be targeting our resources. I'll just finish finally on communication, as I said. This is a quote I came across from Margaret Atwood, and I think it resonates for me that words matter. We need to focus on the way we communicate. Everything we do is communication, and we can have real impact if we think about how we do it intentionally and well. We can have real power. Thank you.
Thank you so much, Dawn. That was a great note to end on. And yeah, really interesting to hear about those key elements of your approach and bringing it to life through those case studies. I also really liked what you said about this not just being about transmitting a message, but creating a dialogue and having a conversation. That feels really important. So thank you. Just to say that the slides from all of our speakers will be available on our website alongside the recording of this, so you can look back on anything that you've just heard. But we've now got a bit of time for questions. So thank you again to Kate for answering various of the questions, and thank you for all of you for posting such good questions in the chat. The first one I might come to you for, Maria. So a question's been asked about applicability in smaller authorities, and recognising obviously there's lots of different contexts in which this work may be embedded and applied, and whether you've got any reflections on working with this approach in a smaller authority with potentially less resources. And then a subset of that question was working with elected members who've clearly got certain kind of political imperatives around balancing short-term and long-term, either in smaller authorities or more generally, whether you've got any reflections on working with elected members to share beyond what you've already said. If that's okay, Maria, over to you.
Yeah, absolutely. Thank you for those questions. So I think in terms of small authorities, perhaps you're working with a very small team, or what I would say is start small. So the great thing about this approach is that the more these kinds of ways of communicating, these frames are repeated, the more power they can have. But even using them in one conversation can make a difference. So what I would say is start where you can. So if you're in a small team, you know, maybe you're not trying to shift the way the whole council speaks to begin with, but maybe you're looking at your communications. Have a look at the toolkit. Which bits of it can you apply when you're talking to different parts of the sector, or when you're putting together new reports? Start there. And what we actually find is it tends to snowball. So when you start using this in conversations, people start repeating it back to you. And actually that's how we can spread the message when we don't have lots of resource, is just start using it ourselves. And we find that that ripples out. Not easy, not straightforward, can sometimes feel like, you know, you're struggling alone. So I don't mean to say it's simple, but start where you can. That's better than not doing it at all. Start there and see how you can help it to grow. And often we find that it starts to snowball. And then when it comes to elected members, and I think people are thinking about, well, you know, would it work for Labour politicians in the same way as Conservative politicians, or perhaps other groups now? What we found when we did the original research and tested is that all the frames that we're recommending worked across the political spectrum. So I think that's really important, is that we used frames that were still persuasive, that were powerful, even if you're coming from a slightly different perspective. So what we've heard anecdotally from people who've started to use this is that perhaps they've had councillors in place for a long time that they've been trying to work with and never really getting that cut through. And suddenly they knew you've used this approach and people are reacting, people are responding, people are saying, okay, well, we should be doing something about this as a council. And so we've seen that this way of communicating actually kind of makes people hear them differently. And that's what this is all about. So really, we've seen it work well with different elected members. And again, I would say sort of start using it, start trying it and testing it and seeing where sometimes we'll need to adapt and emphasize different points with different members, but that overall approach is still powerful.
Thanks, Maria. That's great. Dawn or Chimeme, have you got any reflections on working with elected members?
Yeah, I think from my perspective, it's helpful to think about elected members as any other person, in that this message really does cut through for them. So I have seen it impact really strongly. I think it's been really interesting that those elected members who are closer to the duties around housing, planning, etc., so our district and borough elected members were the ones who would tend to go, well, of course, this makes sense. What are we doing about it? And those are the ones who would sort of push us to actually say, we're completely on board with this message. What are we doing about it? And that enabled us to get into a space where we were then wrapping the building blocks language around the things that we were doing to be able to show that coherence and that really taking action. So yeah, I would say the colleagues that were more difficult to engage in this space tended to be more of our NHS colleagues, and I can reflect separately on that. But actually, our elected members will tend to have their points of view that they want to drive in any case, but they're very open to that conversation, and the building blocks is resonating with them. The other thing I would say is that we did a lot of work at community level. So quite often we'd have elected members coming to us saying, what is this building blocks thing? My community is talking to me about it. And we've certainly had some champions built in that space in parts of our patch as well.
That's great. Thank you very much, Dawn. And I know that some councils have, I think, shared that video that Maria shared with councillors, and that's been quite effective. So yeah, that's really helpful. Dawn, you just mentioned the NHS, and Chimeme, I was going to come to you on this actually, because there've been a few questions in the chat about how you've worked in Luton with the NHS. So if you could just reflect a bit on the experience there, that would be really useful.
Yeah, sure. So we've worked really where the doors have been opened, from, like I said, from the first conference, and using our governance structures. So we have some place-based structures where there are more sort of NHS, local GPs, PCNs and providers as part of the delivery of our health equity town work. And so that's how they've come on board and expressed interest to come to the training that we've done. We don't have everybody, and it's really interesting that Dawn talks about the the NHS, some of the people that we really would like to get, particularly those people who working with communities or those people who are in comms, we've found it difficult to engage with them. They haven't come forward, funny enough. What we have had, though, is that we've had a lot of managers or people who understand and see very clearly that link and probably do a lot of work already with the council. So therefore, they're already engaged. And that's part of the challenge for us, making sure that those people that need it, because we want our communications, the way we speak to people, to be to be embedded in our conversation, and so it's not at the moment. More work.
Always. Thanks, Chimeme. What's really nice in the chat is that there's some questions that have been asked about further examples of how this has been brought to life. And other people in the chat have been saying, oh, we've used it in our annual DPH report, we've used it in various strategies, which has been really nice. And I know when we did a review, it must have been a year ago, of annual DPH reports, I think there were about 50. There's probably more. But Maria, have you got any other things to signpost that you're aware, ways in which some of this has been brought to life in other councils? Is that a fair question for you?
Yeah, I'm just thinking of some nice examples. I mean, what I think we've seen is this really be used at lots of different levels and in lots of different ways. So we've seen, for example, we worked with Active Knots, which was part of the work that we did with Dawn and the wider council, but we worked with Active Knots and we've worked with some of the other active partnerships in the area to really talk about, use this approach to talk about physical activity and actually coming at physical activity from the angle of like, what are the building blocks that are affecting your health and perhaps are missing for you in order for you to be physically active, has opened up really powerful new conversations with residents that they were struggling to have before. When they came first through with kind of, how can we help you be more physically active? People were quite reticent to talk about it. You know, like, it feels uncomfortable. It feels like you're being targeted. But coming from a building blocks approach has opened up different ways of communicating. So we've seen this very community level use in different spaces, which has been really powerful. But we've also seen some councils just kind of use it as the way that they almost talk about public health now. So instead of kind of talking about public health in traditional ways, they've sort of used this to really help land what public health is and does, because so much of the work of public health is around addressing all of these different building blocks of health. So they've kind of used it as a completely different way of talking about the work of their teams. So we've sort of seen it embedded differently for public health, and we've also seen slightly separately it be used in much more kind of campaigning ways. So again, thinking back to that video, like, how do we explain what some of these things are? How do we drive forward action with kind of yes, elected members at a council level, but also perhaps local MPs? You know, how do we really grab attention? And we've seen it used in those ways too. So I think the real beauty of this approach is its adaptability, and that it can be used for community conversations, it can be used for kind of more campaigning conversations, and it can be used in kind of reports and business as usual. So it's got that adaptability, which is, I think, then so important for getting those messages repeated and that story really shifted.
I mean, just to back that up, and there have been a few questions in chat about central government, and actually recognising here that central government are absolutely key part of this whole agenda. And we do use this building blocks language in our policy advocacy work with central government. And actually, I mean, I think we were quite encouraged by the fact that the manifesto and the health mission did explicitly recognise the role of the wider determinants of health, the building blocks of health, and drive your healthy life expectancy. We haven't maybe seen the mission emerge quite as much as we would have liked to, but it is a live conversation that we are having with the Department of Health and other Cabinet Office in particular around the health mission. So yes, I think it does work, as you say, Maria, at different levels for different purposes and different parts of the system. And yes, I also absolutely agree that a key part of this conversation needs to be with central government to support all of the action that is happening at different spatial levels. A specific question's been asked about the creative health system and creative arts. Really interesting. So any examples of how participation in creative arts and access to cultural activities and spaces influences the health of communities? Has that been part of the work in Luton or Nottinghamshire? Would either of you be able to speak to that a bit more?
We certainly haven't, but it's funny because when we talked about it with one of our directors, he felt that was one of the most natural places actually for him to say we should be doing that. We just haven't got round to doing it as yet, but it's something in our minds that has been raised in a couple of places.
That's really interesting. And Dawn, has it been reflected in your work at all?
So similarly, the creative health movement and approach hasn't really presented an East Midlands wide conference on this, which created some connections with colleagues who said they wanted to explore leading on creative health through an academic partnership. So thinking about how this idea of storytelling and using creative approaches to speak about the building blocks of health connected, and we're following up on that, but not explicitly within our region at the moment.
Thank you. Kate, I might bring you in a second just to do a little bit of a summary of some of the things you've been signposting to and answering. That might be a bit of an undertaking, but Kate, if you could just come in a second with some of the questions that have been already answered, that would be really helpful. But before we get there, I think there's lots of interest in various things that Chimeme and Dawn you've mentioned. So, for example, the training programme, I'd imagine things like that toolkit you're developing, Chimeme, would be of interest to people. Is there any of that at that stage?
I'm terribly sorry, that broke up for me, Catherine, so I wasn't able to hear your question.
Oh, sorry, let me try again. I was just asking, there's been quite a lot of interest in the chat and various of the resources that were mentioned as part of your presentation. So, for example, Chimeme, the 2-day training that you mentioned. Is any of that available for people, or is there any further information that you could signpost people to?
So that 2-day training was about us developing our communities of practice. So it currently isn't available for people to do. However, the plan is that those people that went on that training, they are supposed to, it's essentially train the trainer. So they are supposed to be championing and leading that work and putting webinars and lunch and learns on. So that opportunity will be there. How that will show itself with my colleague not around at the moment, I'm not sure, but that's certainly something that that was our thought and our plan going forward. The toolkit is in development, as I said, and we are still working on that, but we have some key tenets, if you know, like, and one of them is obviously to use that language and to be as au fait and as familiar with that language in all different aspects as possible. So once that's developed, that will be shared with anybody who wants it externally.
Fantastic, that's really helpful. And Dawn, is there anything else you can signpost people to that might be available from the things you've mentioned?
So we tend to use the great resources that have been developed by Frameworks UK and the Health Foundation. So we signpost everybody locally to all of the resources that you've got, the toolkit and how to speak about health and what builds good health. I find those really enormously helpful, and in fact was referring to them in a separate piece of work I was doing yesterday to try and think about how I wove the message into a completely different space I was working on. So I would say those are really strong and really meaningful. Beyond that, I find that our approach is iterative and it's about that commitment to be all in and lean into the space. So we tend to use our team we've had to prioritize because it's snowballed and there's so much interest. But as we've grown practice, there's been more and more allies and champions to go into different spaces. When we get asked to help a particular team, it might be practice nurses, it might be a physical activity wellbeing team at local level to grapple with that concept. We go in, we prioritize where we think we can have the most impact, and we go in and we have the conversations. We talk about how we use the building blocks, and we signpost to the Health Foundation's resources. So it's really quite iterative, and I find there's no substitute for trying it in practice. So you'll see it's now sort of seeded throughout our approaches. It's seeded into our ICS strategy. Having said NHS was difficult to engage initially, we now have that building blocks approach driving our fourth purpose and our ICS strategy, and building blocks is built in there. So really it's about iteratively practicing, trying, having a community of practice that uses those tools, rather than having, here's one framework, go use that, or here's one example. We reinvent it, and we live and learn in every instance as we grow this. But it really does, I think the thing that I would encourage everybody is that it has grown organically and with great enthusiasm and passion. So you will tend to find that starts to happen on its own, and people will start to use the tools that are out there to help grow the practice.
Fantastic. That's really helpful. Thank you, Dawn. And yeah, another advert for the Health Foundation Frameworks resources, which we'll make sure have been shared again. Kate, thank you again for going through those questions. Just wondered whether there are any kind of reflections from the questions that you've been looking at, or anything else you wanted to pull out.
Yes, a brilliant and diverse set of questions there. The three things probably I'd highlight. One is to say that the approach that we've been talking about this morning is, I think you can think of it as a kind of communications wrapper. It's not policy, it's not practice, it doesn't replace any of those things. It's simply a way of talking about the things that you're doing, and from building that understanding of the wider determinants of health and boosting support to take action on them. It doesn't replace any of the other important work that people are doing. It simply helps you to build support for it. That means that it's completely compatible with trying other new approaches to practice, with being a marketplace, to tackling the inequalities that we're facing. So first and foremost, this is a communications device. Secondly, lots of people asking for the resources. I think Chloe's just posted them in the chat for people now. Also, in the answered questions on the Q&A, on the first one, I've posted a link to all of the resources that we've done together on this issue, including evaluations. Lots of people interested in evaluation. I guess that brings me to the third point to flag, which is that this approach to communicating is based on proper social scientific research, as people would expect from work that's been funded by the Health Foundation. So just wanted to reiterate that we did the science to understand that this was going to be an effective way to communicate about the issues with a very wide, broad sample of people. And then colleagues in Nottinghamshire and Luton and in many other places are putting it to practice and generating their own data and evidence as well. And we're starting to collect some of that evidence for what works, also what doesn't, what needs to be tweaked and adapted in different places. But that evidence base is growing all the time. So I just wanted to reassure people, none of this is because we think it sounds good. It's all rooted in really sound, robust evidence as well.
Okay, that's fantastic. Thank you so much. And I think, yeah, really important to make that point about evaluation. Okay, we're nearing the end of our time together. But before we end, I just wanted to ask our three panelists a final question, which is, what is your ultimate ambition for this work in your area? And how would you know that you've achieved it? Any volunteers? Chimeme.
For Luton, it would certainly be that our health equity system is using that language and understanding the value of the building blocks and what it means for their health. We have all the challenges that you can imagine in lots of different areas, when very urban environment with, over 50% of our population, very diverse. giving people that language, having public sector using that language, businesses using that language, VCSE sector and communities, all just using it very naturally, that would be a great win for Luton. And it would work because of that disconnect are disaffected people that we have to support into health services and do the prevention work. So yes, that would be our win.
Thank you so much, Chimeme. Dawn, can I come to you and then Maria?
Thank you. For me, my ambition for this is that is really going back to the kind of old school language of health in all policies. I want to see people really understanding and recognizing the impact that they can have on health and on health inequalities in particular from the work that a huge range of dedicated professionals are doing across our county. And if we can join up and collaborate one single conversation that gets people engaged and speaking the same language to really drive change for health, that will be a massive win. So I want to see us creating a space for genuine collaboration, genuine conversations and dialogue, not just amongst our professionals, but with our communities, as you've seen. So that we can get stuff done, because we spend too much time in our own little silos complaining about how somebody else doesn't do something about health. It's all our business, and we need to get stuff done to make it, to seize the opportunity that's on the table in terms of those building blocks of health. So how will I know that we've done it? Well, we're already seeing that we're starting to see the traction on that when people are working together differently to get stuff done. So I'm working together differently with the ICS to get building blocks into the fourth purpose. I'm working differently with my housing and net zero colleagues to think about how do we target retrofit to impact on health inequalities. That's making a real difference to inequalities in our population. So that's giving me the inspiration to keep going, because this is working. Thank you.
Fantastic. Thank you. That's fantastic. And Maria, just a quick, what's your ambition for this work?
So I think our ambition for this work is huge, in the sense that we really do want to get to our ultimate aim, which is reducing health inequalities and actually improving people's lives. That's what this is all about at the end of the day. This isn't just talk, this is about how it drives forwards change. And we know that when we repeat this powerful story over and over again in different ways, that it actually starts to shift thinking. It shifts the way people think about health and what matters and what needs to be done. And when we do that, when we shift that thinking, that actually drives forward and creates a space for change. So that's our ambition. And we want as many people involved in that as possible, because it's going to take lots of us working at different levels in different spaces. We're currently trying to join up different people interested in this work, and perhaps work in some of the kind of regions to get this story repeated. So if people are interested, please do reach out. We want to support as many people as possible to use this story, repeat this story, and actually drive forward change.
Thank you so much. I think that's it. It's all about driving forward change, and hopefully this does help with this. So thank you so much to our speakers, to Maria, to Chimeme and Dawn. It's been really great to hear your insights and experience, and I hope everybody here has taken something away that you can think about further and take action on. Thank you so much for your questions and for your engagement in this session. As I said, a recording of the webinar will be available, and do sign up for updates for further events. We do lots of work supporting local authorities and combined authorities, and we'll put a link in the chat for our updates where you can hear more about that work. But we are so thank you so much everyone and your questions. Have a great rest of your day. Thank you, everybody.